Again, the indications is systemic envelope features. If there is a neurotoxicity or any spontaneous systemic bleeding manifestations, in the incoagulable blood, raised to 20-minute whole blood clotting time or any cardiovascular abnormalities. Suppose if there is any local annoying features, there can be any extensive swelling or rapid progressive swelling, but bites on fingers or toes, again the ASP is given. So these are just some indications of ASP. In case of hyperbole, it can be history of melanoma or hemoptysis. So you can view eventually also in ASP indicated. In this, the patient is having a history of Russell paper. You can see the localized swelling along with ecchymosis and bleeding. So again, it's an indication for ASP. Of the blisters, again indication for ASP. So in this photograph, we are showing the patient from neurotoxic snake bite. So the patient is having a ptosis, again indication for the ASP. So this is a whole clotting test. So this is a very simple test which can be performed with any PACs also. So it is the patient blood has to be drawn and should be kept in a tissue. If it is not in a snake bite, you can see a clot along with the serum, so it is negative. Suppose it is a venomous snake bite, vascular toxic or hemotoxic, you can see it is not clotted. So this again is sure indication of ASV. So do's and don'ts while giving ASV, always administer full dose of ASV, that is 10 vials immediately. Do not be administered to ASV to any patient claiming to have bitten by the snake because it exposes the risk of ASV unnecessarily. And do not delay or withhold ASV on grounds of developing anaphylactic reaction. The rapid development of swelling again indicates a bite, requires ASV, and there is no contraindication to give ASV. So these are precautions to be taken while administering in a dry powder form. It should be diluted with 10 ml of distilled water. These make for 1 ampule of ASV. So ASV should be given by slow IV. It should never be given IV intravascular or injected locally. So the rate of infusion should be initially slow, should be gradual increase in absence with the 400 ml of normal saline, and it should be infused over 30 minutes to 1 hour. So in case of neurotoxic snake, when the patient is having diplopia or ptosis or pooling of saliva or any shortness of breath, so immediately we have to give 10 vials of ASP in 500 ml over 30 minutes. And second dose of ASP, we have to give again 10 vials of polyvalent anti-snake venom over 30 minutes. In low dose, we give 2 vials every 6 hours only as an infusion till the clotting time becomes normal or till 3 days before it's earlier. In high dose, it is 6 vials every 6 hours as bolus therapy. In case of shortage of ASP, we can use this low dose infusion method. Both are equal effective. There is no ASP for snake bite or pig bite, as ASP doesn't contain antibodies against them. So, this is the criteria of repetition of ASP. The persistence or recurrence of bleeding encephalopathy after 6 hours or bleeding after 2 hours, again we have to repeat the dose of ASP. Or deteriorating neurotoxic or cardiovascular signs after 1 hour. Every patient, every vascular toxic or hemotoxic patient, the blood parameters has to be repeated, like the complete blood picture and also PT, INR, CKPT has to be repeated every 6 hours. If you find blood incoagulopathy, then we have to give 1 or 2 doses ASP after 6 hours. So this is the ASP reaction. Immediately we can expect some of the reactions after giving ASP. So it is early anaphylactic reaction, usually seen within 10 to 3 hours. Characterized by itching, urticaria, tachycardia, vomiting, colic, fever and diarrhea. Sometimes there can be a pyogenic reaction. It usually develops within 1 to 2 hours after treatment. There can be chills, fever, rigors and hypotension. Any new signs or symptoms after starting ASP should also be suspected as a reaction to the ASP. The treatment is simple, give IV fluid, always load. We have already adrenaline should be kept ready, so it should be given 0.5 ml IM deltoid. In children, it is 0.01 mg per kg. So injection IM has to be given and restart slowly once this reaction subsides. We have to restart again ASP slowly under close observation. For high-risk patients who had already history of hypersensitivity to drugs or previous exposure to tetanus immunoclobulins or rabies immunoclobulins, or a patient is having severe tropic condition, we have to view ASP only with the signs of systemic innomination present. Sepsis can use noradrenaline. In patient having hypotension along with bradycardia with induced atrophy, and you should closely monitor urine output and maintain urine output more than 1 ml per kg per hour. So these four should underline diuresis, which can be performed at any center. So it usually indicates the patient has oliguria and digital positive, or the patient has eventually to avoid pigment-induced nephropathy and also leading to ATL. Delayed portion underlying diuresis has no role. The how it is performed is intimidation latex followed by a 20 milliequivalent sodium bicarbonate in 500 ml normal saline over 20 minutes. Then again 20 milliequivalent in 500 ml of interlac for 20 minutes. Then 500 5%.
In detail about the management of the snake bite. Nothing has been left uncovered by you. And the way you prepared the slides, it is reflecting the effort you have put to dissipate your knowledge to every one of you. Thank you very much, sir. I invite our last speaker, Dr. P. Malareddy.
Glass scorpion. Scorpion venom contains it is an antigenic complete mixture of neurotoxins, cardiotoxin, and nephrotoxin. There will be these toxins cause massive release of catecholamines like acetylcholine, norepinephrine, and epinephrine. They will lead into autonomic storm. Systemic effect like the clinical picture may evolve within 30 minutes to 6 hours and subside within a day or two. The severity of the sting depends on the potency of the particular species venom, volume of the venom injected, and body weight of the patient. Local manifestations like severe pain and paresthesia. This is the most common symptom. Most of the patients will present with severe pain and paresthesia around the site of sting. Systemic manifestations include autonomic nervous system overstimulation. Initially, there will be cholinergic storm followed by adrenergic stimulation. The symptoms includes cholinergic excess. There will be parasympathetic overstimulation initially, which leads to bradycardia and vasodilatation. There will be we will see the priapism in children. There will be increased bronchial secretions, which lead to bronchospasm in children. This phase is followed by adrenergic excess. This is oversympathetic stimulation, which leads to tachycardia and hypertension, pulmonary edema. This is the cause of death in most of the patients, and there will be in very rare cases there will be multi-organ failure like seizures, fasciculations, and acute circulating venom, which can be neutralized by anti-venom. Scorpion anti-venom is more effective if victim is brought in stage of acetylcholine excess, that is early stage of scorpion sting. Early use of scorpion anti-venom in addition to prednisone will lessen the recovery. If the patient presents in early hours, in the early stage, we can give the anti-scorpion venom along with prednisone. If the patient presents with massive pulmonary edema, we need to treatment. We need to start sodium nitroprusside with NTG and dopamine. And we need to consider patient mechanical ventilation if the respiratory compromise is present. The stage 5 is this is warm shock. It should be treated with dopamine.
The audience side, if they have any question, they are free to ask any of the speakers.
మన వాళ్ళకి చాలా మందికి డౌట్స్ ఉంటాయి. టానిక్ కట్టాలా లేదా, లేకపోతే ఏ ప్రెషర్లో కట్టాలి, ఎక్కడ ఏ లెవెల్లో టానిక్ కట్టాలా ఒక డౌట్. సెకండ్ ఈ స్కార్పియన్ స్టిక్ సంబంధించి ఏమైనా ఒకటేమో టానిక్ గురించి ఒక డౌట్, అంటే ఇట్లా కట్టాలా లేదా ఒకటి, అంటే ఏ ప్రెషర్తో ఎక్కడ కట్టాలి అది ఒకటి. సెకండ్ ఈ స్కార్పియన్ స్టిక్ గురించి లాంగ్ టర్మ్ కార్డియాక్ కాంప్లికేషన్స్ ఉన్నాయని ఒక డౌట్.
Dysfunction or self-limiting. మనం ఇంట్లో చాలా మంది చూస్తాం. యాక్చువల్లీ తెలుగు ఉన్న వాళ్ళు చాలా మంది హాస్పిటల్ కూడా రారు. సో మోస్ట్ ఆఫ్ ద కేసెస్ దే ఆర్ self-limiting. In very few cases, like children or elderly, they will be affected severely due to autonomic storm.
Second, it should not be tightened, so it obstructs the vasculature, distal vasculature. And also, if at all it is advised, it should should be done with only key bandage only should be used, and that also it should be very loose that they should admit a single finger below it. It should not affect the blood, distal blood flow, but also at the same time it should not increase the venous spreading to proximally also. Yes, ma'am.
So is there any difference between a small snake bite and a large snake bite?
Treatment we use nephropathy and also leading to ATM. Delayed portion applying dialysis has no role. The how it is performed is injection latex followed by a 20 milliequivalent sodium bicarbonate in high level normal saline over 20 minutes, then again 20 milliequivalent